You're listening to Kerry Lutz's Financial Survival Network, where you get valuable information you just can't find anywhere else. To thrive in today's trying times, you need the Financial Survival Network, now more than ever. Go to financialsurvivalnetwork.com and get your free newsletter and gift. Financial Survival Network, now more than ever.
Welcome. You are listening to the Financial Survival Network. I'm Kerry Lutz. Today is 1/27/2021. Well, the vaccines are out. I personally know dozens of people that have gotten them. Myself, I am going to wait because I'm probably immune for the next 3 to 6 months at least, based upon the latest brilliance of medical science. But the vaccines, should you get the vaccine? That's really the question. We've got our good friend, Dr. John Huber, with us now, and you can go over to tripsitter.clinic, find out more about what he's doing now. So great to have you back, Dr. Huber. So vaccines, it's all over the news. I'm sure you know zillions of people who've gotten them as well. Hey, by the way, we'd like to know your opinion. Are you getting vaxxed or are you not getting vaxxed? Email us at kl@kerrylutz.com. So for yourself, what are you thinking?
I'm thinking I'm waiting. And part of that reason is I'm not one of the groups that is most at risk. And I think those people, people with compromised immune systems, if you have immune disorders, if you have HIV, if you have cancers, things like that, I think it's essential. You need to choose one of the vaccines, and that creates a whole nother issue too. Which one do you choose? But I think we need to. And if you're debilitated because of age or any other kind of situation, you definitely need. Those individuals are the ones who, when they get it, it is most lethal, and they have to go and take care of themselves. So I really want to encourage those people. For me, I'm relatively healthy. I work out, I eat well. I have good family life, good friends, structure, like all these things that you need to be healthy and considered fit. My concern at this point is, first of all, that I'm not using up a dose for somebody who needs to be injected with it because they are debilitated. But I also am sitting there going, okay, is this going to be the new flu vaccine? And we don't know yet. We don't know. Is this going to be every year? Are they going to make changes to it? We're already talking about boosters that are changing, some of the combinations and the virus, so we can adjust for some of the natural evolution of the virus itself. But let's just say that it hit the world in October of 2019. It's only 16 months old in this derivation, so we don't know how many times or how often it's going to evolve and change. And to jump right out with the first rendition of these viruses, if you're not immune compromised, if you're not in one of the debilitated groups, if you don't have some of the issues that lead to the lethality of this disease being so extreme, I think, those people, we need to step back. We need to let this thing run its course, so to speak, see what kind of changes we need to make to the virus, to the antivirus, and follow that data. We've been giving these injections and I have this conversation with some of the staff at the hospital, and they're like, oh, well, they were tested on 70,000 volunteers. And I go back to one of the indigestion heartburn medicines that they ran all these studies that passed all the FDA. It took years to do it, but the trials were only 12 months. So we didn't know what would happen with people who were on these things extended out to 16, 18, 24 months. And people are on some of these for life. And what do we find out? One of them actually causes cancer. It's causal. It's not contributory. It triggers and causes cancer. So we didn't know that because we only looked at the 12-month studies. And we can look at the same thing what we're doing with these statins that are out there, that, the statins, they lower your cholesterol. They're so good for you and all this. Well, we know it changes your enzyme levels in your body and all these other kind of stuff. But again, none of the studies were over 16 months long. And people have been on those now for decades. And we don't really know what's going on with them and if there's any long-term effects. Yet, they're being scripted time and time again, even though the studies were for 12 and 16-month studies. So I want to see what the long-term rollout of these vaccines are. Are there going to be, vaccine 1.0, 2.0, 3.0 until they finally get it refined? And once we take care of our debilitated population, of our population that has significant reasons, whether it's HIV or cancer or diabetes, whatever those things are, that they get their vaccine and we get this thing and kind of stop its lethality, then I want to start watching and then I'll be more interested in moving forward with it, because I don't want to take away that protection from others when I'm relatively protected. Look at the studies. One of the vaccines is 90, the other one's 95% effective. Well, we know the human body immune system is about 98% effective. So that 2% of our population needs that boost, and everybody else needs to be careful and not try to transmute it when we get it. So there goes washing your hands, social distancing, masking, and stuff like that. So we're already doing part of the problem, and we're taking care of it. And I'm glad it's 2021 and we finally taught this nation how to wash our hands. But
it took long enough.
Absolutely. And we've known, since surgeons were using antiseptics to sterilize their surgical suites.
Yeah, Lister was the founder of the sterile method, and
that's right.
And it saved millions of people's lives over the years. So, and the other thing is, J&J is coming out with a vaccine any day, supposedly, that you're only going to need one shot of, that appears could have better efficacy than the Moderna and the Pfizer vaccine. So then you're saying, well, do I wait for the J&J because it sounds better? And then how long is it going to take them to distribute it? All these questions. And I'm not like an anti-vaxxer out of the box. Definitely not. All my kids have been immunized. I just got the shingles vaccine 4 or 5 months ago, because I just determined that the risk of shingles is way higher than the risk of the vaccine. And that one I had some real side effects the first shot. Flu-like symptoms, slightly feverish, and man, my arm felt like Schwarzenegger had slammed me where I got the shot. It was really painful, John. And so I look at that, and that one's the hundreds of millions of doses have gone out. They pretty much know every side effect there. And yet you still have them. You have them from every vaccine. But most of the people I've spoken with really had little to no symptoms after the first shot. And after the second was even easier.
Right.
So,
right. Once your body's already starting to build those antibodies, it doesn't tend to have that huge immune system response. It's more subtle and gradual. So, yes.
Yeah, very true. So when you look at all these things together, and if you're healthy, you don't have a vitamin D deficiency, waiting could conceivably, and you might not even have a choice to wait, but to wait. Maybe it's the best.
Right. It's supply and demand. They if they ramp up so they can make 300 million doses of this in 6 months, in 6 months, the whole nation will be fully vaccinated. What are they going to do? Close the plants down? I mean, that's kind of unrealistic. So they have to increase capacity with what they have as far as the actual structure to put that in place. And, even Fauci now is talking about herd immunity. I think it's funny. Before, when we were talking about, hey, we need to let more of our healthy population get this so we get a herd immunity and shut the virus down. And he jumps out saying herd immunity is not real. It's false.
Doesn't exist.
And now he goes, let's get the shot until we got herd immunity. And I'm like, wait a minute, guy, which one is it? It's you can't have it both ways, but he's getting it that way right now. And I think he's been given kind of a flag through on some of his false predictions, and the media just, immediately ignores them and moves forward and turns around and uses what he says for their benefit, the media's benefit, and it may not be our population's benefit. And yeah, I'm not telling you he's not smart. I think he knows exactly what he's talking about, but I think, you and I are both in entertainment, whether we want to call it this or not. And we know how we want our listeners to listen. And so we try to posit the best information that is also the most seductive. We want listeners. We want people to come in and listen, and we have to balance that. And it's very difficult. And then, when you get somebody, Fauci's been advisor to a president since Reagan. He's been to every presidential cabinet since then. And, all of a sudden now, after, 40, almost 50 years of being behind the scenes, he's getting the spotlight. And it's weird to have that. Yeah, it's weird to have that experience. And, I can imagine that, being in front of the president's cabinet and the president himself, vice president and senators and everybody, that you're going to feel, intimidated at first. But when they start listening to you and making national policy, that's very probably overwhelming. And, it's going to feed that ego of each one of us. So we all have this ego. And I'm not saying it's narcissistic, but what happens is you start thinking, I'm infallible, and it's not unusual. It's not some sort of, broken part of his personality. It's human. And, I know I've felt different ways, and people start asking me these questions, and I have to step back and go, that's not really something I'm an expert in. We can talk about what my patients have experienced. We can talk about X, Y, and Z, but that's not something I would consider myself an expert in. And I'm not a virologist. I'm not an expert in viruses and anti-vax information and all that kind of stuff. I know my whole family has been vaccinated. We got all our required vaccinations. I've had the pneumonia vaccine. I keep missing out. Every time I go to get my shingles, they're out of it. It's really crazy. And you got to have a series of them. Yeah. And then I've had friends around me who got shingles, and I'm thinking, dude, I should have got my vaccine already. And then it's really interesting how that's something I want, like you have had, and it's just not working out that way. It's like maybe there's a reason why I'm not able to access it. I don't know. I think we have a lot of stuff going on in this world, and when you get somebody who is highly respected by the lawmakers of this country, and all of a sudden you put them in front of the camera, and not only is law being made based on what you say, but now the whole country's mood and affect is controlled by what you say. Man, that is so powerful. It was funny when he got called on some of this stuff, because there was research out there going back to 2005 from the CDC that said that masks don't work with viruses like the flu. And he denied ever seeing any of that. And somebody pulled the article out. He was the lead researcher on the article from the CDC.
Yeah. Oh, it's ridiculous. And then initially he was saying, don't wear masks. Remember that. It's like, no, you don't want to wear masks. Whatever you do, it's not good. There's no proven benefit to it. And then a month later, it's, oh, no, got to wear a mask no matter what you do. There's a lot of inconsistencies coming out of the guy.
Don't just survive, thrive. The Financial Survival Network.
Today's show is brought to you by Mustango River Resources. Their flagship projects are located in Kirkland Lake, an established gold camp that has historically produced over 70 million ounces of gold. The Kirkland West project is a high-grade gold project beside Kirkland Lake Gold's world-class Macassa gold mine, one of the highest-grade mines in the world. The Umeja project is an advanced stage project with 600,000 plus ounces of gold along the Cadillac Break, 25 kilometers east of Mikasa. Their projects have the potential to transform into another world-class mining camp in the Kirkland Lake District. Make sure you go over to mistango.com. That's MISTANGO.com. Take a look and sign up for notifications. Stock is traded on the Canadian Stock Exchange, ticker symbol MIS. For more information and to sign up for notifications, go to mistango.com.
This is the Financial Survival Network, the information you need to thrive now more than ever.
Yes, and the research behind the masks, there's so much messed up research. It's misinformation. If you're sick, if you go outside, I think you need to be wearing a mask. Mm-hmm. It's not going to stop the spread, but it will surely slow down the spread.
Yeah.
And that's what we've done every time before in this country is we only quarantine sick people.
Right.
And when you don't quarantine sick people, when you quarantine everybody and you shut down businesses and things like that, that's something worse than quarantine. I'm not going to go there. I'm going to try and stay out of politics. But you got to start wondering when this happens and nobody stands up for, hey, wait a minute. This isn't how we've treated every other disease once we figured out about infectious diseases. You quarantine the sick people, not the healthy people.
Mm-hmm. That's a little strange for sure. I look in Florida, how many people are actually in there for COVID? We can't get an answer on it. The data that we really need to treat this thing intelligently just doesn't exist.
Well, it doesn't. And then, the CDC came out and this weekend, and said that the whole the biological testing that they're doing, where they oversample your DNA to identify the DNA of COVID, is basically inaccurate, because basically they can take any sample and if they replicate it enough and they do the oversampling like they do, eventually they'll catch the virus in there, because it just propagates over time. And it's pretty scary when you think about that, because how many people actually don't really have the virus, but maybe when they had their brain, I call it a brain swab because I've had it too many times, and it goes up your nose. And,
I hate it.
And it feels like they're scratching your brain, and they pull it out. Your sinuses have these amazing, hairs and fibers and stuff in there that are designed to stop viruses and bacteria from getting into your biological systems. So they go in there and swab it. Maybe they've caught one or two viruses that got stopped out there, and you don't have any symptoms, and you never will have symptoms possibly. But they pull it out and said, "Oh, you're asymptomatic, but you tested, using this test." And now they're saying, the CDC saying, if they use that sampling test, they have to confirm it with a second antibody test that's different, and to confirm the cases. Because I think again, we're sequestering healthy people as well as, taking our sick people and keeping them away from everybody else for actual health reasons. And I think we're creating much bigger problems with the suicide rates, with depression,
drug overdose,
everything. And it's a scary situation, because, 80% of our people working in this country work for small businesses. And all of a sudden, the only essential businesses are Walmart, Target, Sam's, Costco.
Yeah.
And, and liquor stores. And, I don't know any of my friends who work at liquor stores that have gotten COVID, but maybe it's the alcohol. I don't know. But what makes the little grocery store with the restaurant in it at Sam's or at Costco essential over mom and pop grocery stores that have been running for 20 or 30 years that have a very narrow margin of income, and they shut them down, and now they don't have any income, and the place goes away and it never comes back. They say 60% of New York City restaurants are gone forever.
I know.
And that is one of the best reasons to go to that city. And it's disturbing. I know I was there in August, and 1 in 5 places was open, the other 4 were closed, and it was pretty bizarre walking down the streets there when people would. It was like I was back in Texas, but in New York City, because they were so happy to see people. They were actually talking friendly to you, and hey, how are you doing? Be safe, and being friendly. Whereas, that's not the New York I have fallen in love with, where people mind their own business and, you got an objective, they got an objective, and, just stay out of each other's way. All of a sudden, I feel like I'm walking downtown Austin, Texas again. And it was nice and it was shocking at the same time. So
I totally agree with you. And I was in New York, and it was amazing. Like every third or fourth store was empty.
Yep.
Every
Completely.
retail. And then when you went, New York has always had a housing shortage. For the first time ever, I see every apartment building, it's got a for rent sign, luxury apartments available, and they've cut the prices. You never saw price of rental housing in New York decline. It was completely shocking.
They have rent control there in New York City, and it's based on the total population of occupancy. And when it drops below 10%, then the rules across the board, there has to be a cut in all the rents across the whole city. And it was funny to hear de Blasio jumping out and saying, oh, well, because of COVID, we're not going to measure the occupancy rates for the next 24 months. Mm-hmm. Oh, really?
Yeah.
And so they didn't. They haven't gone back in, because that's the benchmark, that the laws that are in place that enforce this socialization we have with housing in this democratic city known as New York City. Right, wrong, or indifferent. It's there and it's in the law. Well, if they don't count and measure the trigger statistic that triggers this, then it never happens.
Yep. I couldn't agree more. Well, we got to get going. So just go over to tripsitter.clinic and you can find out more about what John's doing in mental health, and might help you. And any questions or comments, email us, kl@kerrylutz.com. John, always a pleasure, and we'll talk to you again real soon.
Sooner than later, I hope.
Thanks for listening to Kerry Lutz's Financial Survival Network, your solution to today's trying times. For the latest, go to financialsurvivalnetwork.com. Financial Survival Network, now more than ever.